This video comes to you from Aurora BayCare Sports Medicine and highlights the basics of concussion management and the team approach we take at Aurora BayCare to manage one's concussion most efficiently and effectively to return you back to the playing environment. A concussion is a traumatic brain injury that results from a sudden jolt of movement of the head or impact to your head that disrupts normal brain function, which may or may not result in a loss of consciousness. Possible symptoms are listed below. They may appear immediately following a concussion or within days of that concussion. Concussions are individualized injuries. No two concussions are the same, and you will most likely have different symptoms and different recovery times. You can't compare your concussion to one of your friends. Active treatments targeting specific symptoms will enhance recovery, and we know that the best approach is the team approach. During the first 24 to 48 hours following a concussion, focus on your recovery by resting, eating healthy, sleeping, and hydrating. We want to get you back into the classroom and your sports as quickly as possible, so physical therapists will guide you safely back to activities that don't worsen your symptoms. Athletes should follow a stepwise process in order to safely return to the classroom and their sport. That will be guided by your physical therapist and athletic trainer. The treatment of just rest in the dark room has been proven to be ineffective and will prolong one's recovery time. Aurora BayCare follows a specific return-to-learn progression. This is guided by the physical therapist and high school athletic trainer to get you back into the classroom as quickly and as safely as possible. Similarly, Aurora BayCare has a specific return-to-play progression that guides the athlete in a stepwise manner to safely return to their sport. This is guided by the physical therapist and athletic trainer. Prior to returning to competition, the athlete needs clearance from their physical therapist or referring provider. Physical therapy is a crucial part of the concussion team. We work closely with your athletic trainers, coaches, and other medical professionals to assure a collaborative team effort in concussion management. Physical therapists spend one-on-one time with the athlete for extended periods of time. They specialize in vestibular therapy, vision rehabilitation, balance training, manual therapy, and therapeutic exercise. They safely advance physical activity while monitoring symptoms. They use computerized testing to assess memory, processing speed, and reaction time. They provide individualized education for returning to the classroom and sport. There may be subtle symptoms that may not be obvious to you, but may show up when you return to school and sport that may affect one's academic and athletic performance, such as reaction time, memory, focus, concentration, and multitasking. There are various subtypes of concussions. Your physical therapist will determine which concussion subtype or types you are experiencing to help determine the best plan of care that's targeted to your concussion trajectory in order to get you back onto the field as fast and as safely as possible. Athletes may experience neck pain following a concussion. Your physical therapist can address this with hands-on techniques to the neck region. This can also be addressed with the various other tools physical therapists have in the clinic to alleviate one's pain. Proprioception is the body's ability to sense location, movement, and action. It is affected by a concussion and can impact one's balance and coordination. In this video, we are testing proprioception with the modified COBOL test, which we can then use to help guide treatment. Concussions often affect the body's ability to tolerate cardiovascular exercise, including its ability to manage one's heart rate and blood pressure in response to that exercise. This can result in physical deconditioning. Here, the physical therapist is performing the concussion buffalo treadmill test to guide physical activity prescription. Vision testing and training is essential for our athletes following a concussion, as research has shown that vision is affected in up to 60% of concussions. One tool physical therapists use is a Marsden ball to improve eye tracking while progressing to be sport-specific. Another tool used in vision rehabilitation is tranoglyphs. It helps with the ability for the eyes to work together, which is essential for an athlete's depth perception. Athletes may experience dizziness following a concussion. Your physical therapist can determine the source of this dizziness. One of the causes could be benign proximal positional vertigo. In this video, you see the physical therapist testing and treating for the condition. Your physical therapist will need to determine the side and canal involved in this condition in order to provide the appropriate and necessary treatment to get rid of this type of dizziness. If one does not have benign proximal positional vertigo, but does still experience dizziness, this may be due to a vestibular dysfunction following a concussion. There are specific exercises your physical therapist will prescribe to address this deficit, along with making it sport-specific for the athlete. Reaction time is often impacted following a concussion. In order to safely return to sport and return to your prior athletic ability, your physical therapist will address this with various drills such as the one shown here. Dual tasking is essential for athletic performance as there is so much to be paying attention to during sport, such as the play you are supposed to run, the location of your team members, the score of the game, the time left in the game, what the coach is communicating to you, and so much more. In this video, you see the individual standing on an unstable surface for a balance challenge while completing math facts shown on the screen, which is then progressed to the completion while wearing strobe glasses and involving the individual's sport. Physical therapists can see many orthopedic injuries without a referral. However, physical therapists require referrals to evaluate and treat sports-related concussions. The athlete's athletic trainer can help coordinate a referral to physical therapy following a concussion. Referrals can be obtained from any of the following providers. If you have any additional questions, please contact your high school athletic trainer or Aurora BayCare Rehabilitation and Sports Medicine. We look forward to helping you manage concussions in the most efficient, effective, and collaborative manner possible.